So the material I'm presenting you today is based on MEWS scoring and implementing this for sepsis indication. So what is the MEWS score? It stands for Modified Early Warning Score. This scale is a simple to use biological score used to improve quality safety measures for our patients. The things that the MEWS covers is respiratory rate, heart rate, level of consciousness, urinary output, and systolic blood pressure. So it's looking at these 5 aspects for every single patient, every shift. The purpose of this score is counteracting any delays in transferring or implementing necessary measures for critically ill patients. The end goal of MEWS implementation is recognizing unstable changes more efficiently to prevent severe sepsis. So in other words, it's looking at these 5 aspects. If the more crucial the levels are, the higher the score will be, the quicker the action needs to be. So my question for this assignment was, does implementing the use of the MEWS score on medical surgical units influence earlier detection of sepsis? So the reason I chose this topic is working on a medical surgical unit, we get a variety of patients ranging from surgeries to ICU transfers. Kind of everyone's at a different state of where their care is. This score is allowing us to collaborate with physicians and surgeons to have a mutual understanding. If the score is higher, the physicians know, okay, this is a critical patient. We can all kind of relate. There's hesitation from the nurses. We got trained on MEWS scoring, but a lot of them felt frustrated that it was going to take more time off their shift and be another thing that we were assigned to do. So it kind of was up in the air if we wanted to do this. Here's a scoring example. So we have a post-op patient of a knee surgery. Respiratory rate is 22, pulse is 124, systolic BP 150, temperature 38.1, new onset agitation, his urinary output's fine. So based on those levels, I generated a MEWS score, triggering him for the critical values. His score was a 6. For this scenario, it would be most likely a rapid response. You'd be notifying the primary care physician, the physician who's on call, the charge nurse, and doing necessary actions. This is an extreme case. Say the score is a 3, it'd be something more like notify your charge nurse and get vitals every hour. So the assigned article, our class research discussed subcultures of patient safety. MEWS implementation first emphasizes evidence-based practice. So all necessary members of the healthcare team that range from, again, the techs to the physicians establish these findings. This will lead to more straightforward assessments. Patient-centered care is the second aspect covered in this article. Early sepsis screening promotes patient-centered care. So this article states that the aspect promised to value the patient by providing a healing environment during the hospitalization and also to promote the health and well-being as a continuum of care. Patients prefer a personalized approach, and the MEWS provides this every shift for every patient. I was able to look at other articles. All of them favored the MEWS score. Several of them covered the ER and statistics in the ER and indicated that when the nurses were doing these, critical patients were transferred to the ICU and had much better outcomes. Another aspect of research is that it works more efficiently and accurately than the previously used Sears criteria, which for us, we used PowerChart and Sears would fire, and this has been proven to be more accurate than that system. Lastly, it showed that a monthly sepsis-related mortality rate immediately dropped when you implemented this tool. So patient deaths are actually less when this tool is used. So my plan for this system and my proposal is that the MEWS definitely needs to be generated every shift, every patient. I know it's time consuming and it's another step for nurses, but I think in the long run it's worth it. One article mentioned doing an electronic MEWS, which you put in the vitals and it generates the score for you, which averages about $3.75, $3.75 a patient. This could seem like a lot, however, I think the benefits outweigh the risks. Again, I would like to do a 6-month analysis and kind of see when this is done, every single shift, the outcomes it has, and that way we can present it to the nurse coordinators, director of nursing, everyone, and just kind of gauge how successful it is. So benefits to nurses in the long run, I think it'll help us collaborate with the healthcare team better. And I think nurses are at a forefront for monitoring a patient's physiological state. So the MEWS scores will provide confidence, and then we can treat our patients proficiently.